So excited to be back again. Welcome to another session on education on breast cancer. Today we are going to be talking about cancer on a whole. I'm sure each of you may know somebody with cancer, whether it's lung cancer or cervical cancer, prostate cancer. We are going to be talking about cancer. What exactly is cancer? You hear so much about this really, really dreadful disease. You know that our body is really made up of trillions of cells, and they're there for a particular function. And what happens in your body is that the cells do what they're supposed to do, they get worn out, and they are replenished by new cells. And you know your whole body is made of trillions of cells, your liver, your skin, your muscles. It's all made up of cells. So what happens in cancer is that the cells, they do not get that message where they need to stop multiplying. So you find that the cells are just multiplying. They're growing and they're growing and they're making a lot of new cells, and they're not dying like your normal cell would die. For example, if you look at your legs, sometimes you may find your skin is very dry and sometimes scaly. It's dead cells being replenished. So it's done what it's supposed to do. It dies and it's replaced by fresh, brand new cells. But in the case of cancer, the cells continue to multiply. And it can happen anywhere in the body. It can happen in the lung, it can happen in the liver, it can happen in the breast, it can happen in the blood. And what happens when your cells continue to multiply, they push through the tissue that surrounds them. And that's what you say, it's invading the area that's surrounding. So it's pushing through blood vessels. It's pushing through the tissue around it. It's pushing through lymph vessels. And when that happens, the cancer is moving to another part of your body. So it may move to your bone, it may move to your brain, it may move to your liver, it may move to your lung. So what happens, what really causes your cells to continue to multiply without stopping? Now, when the cells continue to multiply, they grow into what we call a tumor. That is, it's multiplying, it's becoming huge, it's becoming, a growth. Now, this tumor can be benign, which means the tumor has grown big, but it's not invading the tissue. It's not, and the cells are not abnormal like the cancer cells. Now, it can either be benign or it can be malignant. And when it's malignant, it means that the cells are growing so rapidly, it's difficult to tell what kind of cells they are. And two, they're invading the tissue around it. So they're going through blood vessels and they're invading the tissue and the lymphatic channels around it. And these are called malignant cells or cancerous cells. And like I said, it can happen anywhere in your body. And what are really the causes of cancer? I'm told that it can be caused by, one, you either inherited a gene from your parents where you are at higher risk for these abnormal cells from developing. So you've inherited that gene from your mother or your dad. Or it could be just during the multiplication of the cells, something happens, what we call an error in the genetic makeup. So something happens and that cell becomes cancerous. Or it can be just from environmental factors. You are exposed to some chemical in your environment, or you are exposed to radiation, ultraviolet rays from the sun, and that's where you get different kinds of cancer, sometimes cancer of the skin and cancer of your different organs. And so, like I said, it happens anywhere in the body. It can happen in the breast. And sometimes when physicians pick up a cancer from another part of the body, sometimes it's not the primary site. So you may find that they will pick up cancer in the bone, or they may pick up cancer in the liver, but it's really not liver cancer, it's actually breast cancer. So once the cancer has moved from the primary site to a distant site, what we call metastasis, and that's the reason, and sometimes they may say you have metastatic breast cancer, meaning that the cancer has moved from your breast into a distant site or location. Whether it's to the lymph nodes, it has moved to the liver or to the lungs or to the brain or to your bones. So this is metastatic breast cancer. And when the cancer is found in that distant location, it is still called breast cancer. And so there are many things that we can actually do, and sometimes we have to change our lifestyle. There are risk factors, like I said, it may be just a genetic factor that you picked up from your parent, and there's nothing much you can do about it. But there are some things we can do, actually lifestyle changes, to prevent ourselves from coming down with cancer. For example, typical example, we can stop smoking or consumption of alcohol, and we can protect our skin when we're outdoors. When you're out on the beach or you're out in the yard weeding or pulling, you can put some sunscreen on to prevent yourself from the damage that happens to your DNA and causing you to come down with cancer. And so this is generally what cancer is. It's just an abnormal development of the cells. They're multiplying rapidly, more rapidly than normal cells, uncontrollably. So they're growing and they're growing, and they're forming a mass which invades the tissue. So so you may have a cancer in the uterus that punctures the bladder, or you may have a cancer, in one organ that will go through the other organ. And so this is a difference between a malignant tumor and a benign tumor, where the benign tumor is just, yes, the cells is developing, but it's not abnormal and it's not invading the rest of the tissue. Dr. Paula's Breast Health is actually the mouthpiece of the Caribbean Breast Cancer Foundation. I wanted to let you know about an event we are having on October the 6th. Educational outreach and luncheon. What we do is we celebrate the lives of women who have been through breast cancer, like me. And also we have a guest speaker who's going to be speaking on breast cancer. This year it's going to be Mr. Eric Taylor, who's a nurse practitioner. And he's going to be bringing some very good information about breast cancer. And because there will be so many in the audience, Eric Taylor, who is the founder of Priority Male, that's another nonprofit in the Houston area, he will be, just throwing out a few facts about prostate cancer to the men in the audience. So if you want to come out and celebrate our lives, we want you to go to caribbeanbreastcancer.org to purchase your tickets, or you can call 281-222-3415 for hard copy tickets if you choose. It will be on October the 6th. Less than 2 weeks from now, and it starts at 1 p.m. So we want you to come dressed in pink, ready to celebrate the lives of women who have gone through this dreadful disease. Come out and support. Come out and celebrate the life of a loved one, a sister, an auntie, a friend, or whoever is in the hall on that day who is a breast cancer survivor. Thank you, and I hope to see you there. Our next video will be really focusing on breast cancer. What is breast cancer? What are the risk factors for breast cancer, and the different stages and the different types of breast cancer. So I'm really, really excited about the series of stuff that we're going to be talking about. And if you love the information that you're getting, it is very critical that we all know, about cancer. Because if you are alive and you are inhaling the environmental toxins, you are eating or you are ingesting some of the toxins in the food, you are exposed to sunlight unprotected, not having your sun protection on, you are at risk for cancer. And then if you're a woman, definitely you are at risk for breast cancer. And so this is what we're going to be talking about. Very excited. If you know someone who is definitely going to benefit from this information, definitely everyone can benefit. I need you to share the video, send it to your friends, your family, ask them to view the video, subscribe, and press that bell so you can get a notification when my videos come out. Thank you so much. We're on a journey to educate ourselves about cancer, specifically breast cancer. Thanks for watching. I really, really appreciate it. See you next time. Thank you.